Hello, and welcome to this educational video on the Nipah virus and its recent outbreak in India. Today, we're going to break down what the Nipah virus is, how it spreads, the history of outbreaks in India, details on the current situation, symptoms to watch for, and most importantly, how to prevent it. Knowledge is our best defense against infectious diseases, so let's dive in. The Nipah virus, often abbreviated as NIV, is a zoonotic virus, meaning it jumps from animals to humans. It was first identified in 1998 during an outbreak in Malaysia and Singapore. The virus belongs to the Henivirus genus in the Paramyxoviridae family. Its natural hosts are fruit bats, also known as flying foxes, from the Pteropus genus. These bats can carry the virus without showing symptoms, but they can transmit it through their saliva, urine, or droppings. In humans, Nipah can cause severe illness, with a fatality rate ranging from 40% to 75%, depending on the outbreak and access to medical care. Unfortunately, there is no specific vaccine or antiviral treatment for Nipah yet. Treatment focuses on supportive care, like managing symptoms and preventing complications. However, research is ongoing, and monoclonal antibodies are being tested in trials. India has experienced several Nipah outbreaks since the early 2000s. The first was in 2001 in Siliguri, West Bengal, where 66 cases led to 45 deaths, a shocking 68% fatality rate. Another hit Nadia district in West Bengal in 2007, with 5 cases and all 5 fatalities. More recently, the southern state of Kerala has been a hotspot. In 2018, 19 cases in Kozhikode and Malappuram resulted in 17 deaths. There was a single case in 2019 with no death, 1 fatal case in 2021, 6 cases with 2 deaths in 2023, and in 2025, 4 cases in Palakkad and Malappuram with 2 deaths. These outbreaks highlight how Nipah can emerge sporadically, often linked to bat habitats overlapping with human activity. Now let's talk about the most recent outbreak. As of February 2026, the World Health Organization and Indian health authorities have reported 2 confirmed cases of Nipah virus in West Bengal. Both cases involve 25-year-old healthcare workers, a nurse and a colleague at a private hospital in Barasat, near Kolkata, in the North 24 Parganas district. They developed symptoms in late December 2025 and were confirmed positive via RT-PCR testing on January 13, 2026. One patient required mechanical ventilation due to severe respiratory distress, while the other experienced intense neurological symptoms but has since shown improvement. Importantly, contact tracing identified 196 people who interacted with the cases, and all tested negative for the virus. No additional cases have been reported as of late January 2026, and the outbreak appears contained. This human-to-human transmission likely occurred in a healthcare setting, which is a known risk for Nipah. The source? Possibly linked to fruit bats in the region, as genetic studies from past Indian outbreaks show close similarity to strains in local bats. How does Nipah spread? The primary way is through direct contact with infected bats or their contaminated fluids. For example, eating fruit partially eaten by bats or drinking raw date palm sap that's been tainted. In some outbreaks, like in Malaysia, pigs acted as intermediate hosts, amplifying the virus before it reached humans. Human-to-human transmission happens via close contact with bodily fluids, such as saliva or respiratory droplets, especially in hospitals or during caregiving. It's not as contagious as COVID-19, but it can spread in families or healthcare settings without proper precautions. Symptoms usually appear 4 to 14 days after exposure, though it can be up to 45 days. Early signs include fever, headache, muscle pain, vomiting, and sore throat, similar to the flu. As it progresses, it can cause dizziness, drowsiness, altered consciousness, and acute encephalitis, brain inflammation. In severe cases, patients may develop seizures, coma, or respiratory issues like atypical pneumonia. Survivors might face long-term effects, such as persistent convulsions or personality changes. If you suspect exposure, seek medical help immediately. Early detection can improve outcomes. Prevention is key since there's no vaccine. Here's how to stay safe. 1. Avoid consuming raw date palm sap or fruits that might be contaminated by bats. Boil sap before drinking. 2. Practice good hygiene. Wash hands frequently, especially after handling animals or in bat-prone areas. 3. In outbreak zones, use personal protective equipment, PPE, like masks, gloves, and gowns, particularly for healthcare workers. 4. Reduce bat-human contact by not disturbing bat roasts and using nets over fruit trees. 5. If you're in an affected area, follow local health advisories, like quarantines or travel screenings. Governments and organizations like WHO are enhancing surveillance, training healthcare workers, and researching vaccines to prevent future outbreaks. The 2026 West Bengal outbreak reminds us that emerging viruses like Nipah require vigilance. But with education and precautions, we can minimize risks. Stay informed through reliable sources like the WHO or your local health department. If you found this helpful, share it to spread awareness. Thank you for watching. Knowledge saves lives.